Good morning, everyone. Sorry for the delay. My name is Gina Ford. I'm the Communications Director for Prince George's County Executive Angela Alsobrooks. We'd like to thank you for joining us as the County Executive brings some updates in our vaccination process. And Dr. Carter will bring the latest on our COVID numbers and how we're doing with vaccine. County Executive.
Good morning, everyone, and I thank you for coming out this morning. Again, I am here today to give you an update regarding our county's vaccination efforts. And we are, as you know, still at the very beginning of our vaccination process, and so I want to thank everyone for their patience. As you well know, we have encountered a few challenges, as it were, but just as we overcame challenges in the very beginning of this pandemic with respect to ramping up for testing, I have every confidence that we will adapt to the challenges that we are seeing now as we move forward. Before I go any further, I would like to say thank you, a big hearty thank you, to our entire team. They are absolutely amazing. And I want to thank Diane Young, Kim Stenchum, Homeland Security Director Ronnie Gill, Tyrone Wells, Tony Grimes, and our entire Health Department team and the Office of Emergency Management. They have just been spectacular, have been really tireless in their efforts, and I certainly want to thank all of them for their hard work. I gave them a tall task, and the task was to ramp up quickly to ensure that we were able to get vaccines in arms, and I have to tell you that that's exactly what they have done, and so we are so grateful for their efforts. I want to thank Dr. Carter, who is here as well, Dr. Askew and the team. They set up a facility that serves, I believe, as a model for not only our area, but for the state and for our region. And it is a first-class facility. It is very professionally run. I've heard really great comments from everyone who's had an opportunity to go there. I, of course, have been there as well, and I know that this team will continue to build on their record of success, and I thank them for it. As you all know, we've started our COVID-19 vaccine rollout, and so far we have administered thousands of doses in Prince George's County. I know at the outset there have been many, many concerns over who has been able to sign up and receive the vaccine in Prince George's, including concerns about individuals from neighboring counties and jurisdictions who are non-residents who have been receiving that vaccine. What you should know is that we put up the Maryland State site. It's called PrepMod. It's the website. And there were a good number of people who signed up through that website who were not Prince Georgians. They did so through our sports and learning complex, and so we had a good number of individuals who signed up through that website who were not Prince Georgians. And I have to tell you, I have heard loudly and clearly about the concerns. We share those concerns, and so I apologize this morning. I just want to send out an apology to everyone because I know it caused great concern, great consternation, as it should have. And so we are here, we fixed it, and when we realized that so many from outside our jurisdiction were taking up appointments that were intended for Prince Georgians, you should know that we made adjustments there, and because initially what happened is a good number of those appointments were made because the state website did not prohibit individuals from other jurisdictions from signing up. We have since replaced those appointments with our older seniors and those who work in our county to ensure that they were able to receive the vaccine. At the beginning of last week, I came out and spoke with you and told you that we were resetting those appointments until after February 9th because we did not want to cancel the appointments of thousands of Prince Georgians who had already scheduled them. But we also realized that we had to ensure that equity occurred in terms of the delivery of vaccine in our community, which was, by the way, as we all know, the most impacted in the state. And so as we announced last week, going forward, you should know that we will make vaccine appointments available to residents and those working in Prince George's County only, based solely on our pre-registration form, which you can find at mypgc.us/COVID vaccine. Again, mypgc.us/COVID vaccine. That's the pre-registration form that we're using now. That form allows us to look and to make sure that we have individuals, again, who are either residents of Prince George's County or work in Prince George's County only. So as we continue to cancel and issue new appointments, we will continue to send out private appointment links to qualified residents based on completed pre-registration forms. And so I encourage everyone who lives and works in our county in all phases, but especially those who are in 1A, 1B, and 1C, to sign up for vaccinations using our pre-registration form. Due to the limited amount of vaccine, the supply that we have at this time, we will not be able to honor the appointments made by individuals who do not live in Prince George's County or work in Prince George's County. And we will be checking identification for proof of residency or proof of employment in Prince George's County for every vaccination appointment going forward. In consultation with our Chief Health Officer, Dr. Carter, we have canceled all vaccination appointments for those who do not live or work in Prince George's County. We want our seniors to be prioritized, and so we have canceled these appointments to make sure that people who live here and work here are able to get the vaccine. We're continuing to work with our health department and across jurisdictions to make sure our vaccine efforts move forward for our county and for our region, and we do not yet, as I've mentioned, have the supply we need for everyone, so we ask for your patience as we work to vaccinate all those who are in need of this vaccine, but in particular those who are newly eligible and who are vulnerable. For the past year, we've had to confront a host of new challenges that this pandemic has thrown at us. It has been an unprecedented time in our history, not only of our county, but also of our nation, and the development of these vaccines and the task of administering them to thousands of residents has really been a challenge for us, but we're working to get the vaccines in those arms, and we're really ramping up our efforts and increasing our capacity all along. Here in Prince George's County, we are doing everything we can to confront this newest challenge in a fair and equitable way. And so I cannot promise you that this will be the last test that we face during this time, but the thing that I can promise you is what I always have, and that is that we will be honest with you, that we will be transparent with you, and where we find a challenge, we're going to come out, name the challenge, and we'll work to solve it. And so we just really thank you for your patience as we work through the obstacles that we see here. But again, we will always be honest with you, open with you, and transparent with you. And any challenge that we find, we're going to fix it. I also promise you that we're doing everything we can, no matter what, to prioritize Prince Georgians in our vaccine effort. And we're making sure that residents have first access to this life-saving vaccine and are not in the back of the line. And so we thank you for bearing with us as we expand the number of Prince Georgians who are proud to be protected from COVID-19. In addition to this change, we're also working through another important issue, and that is that we are concerned about our seniors who have been having to wait outdoors in long lines to receive their vaccination. I've been hearing this concern raised as well. So starting today, we are implementing a plan for seniors to remain in their cars, please, so that they do not wait outside for their appointment. It is way too cold. This is not a good time. We don't want our seniors, many of whom are not able to stand for long periods of time, some of whom are not mobile. So what we will do is to place a number on their car and bring them inside the vaccination site when it's their turn to receive the vaccination. We believe that this will be safest and most convenient for our seniors. And I also want to say to our amazing seniors, and let me tell you, the seniors of Prince George's County are not playing. They don't kid around. They are serious business. They're eager to get the vaccine, and so they have, some of them, shown up 2 to 3 hours ahead of their appointment time. We are not surprised because, as I said again, these are some vigilant seniors, and they want their vaccines. And so what we want them to know is that coming 2 to 3 hours ahead of time actually will not speed up the process, and we discourage seniors, if you can, please not to come that far in advance for your vaccine. Please come on time. But please don't come too early, and we believe that this is contributing to some of the lines that we're seeing, and it won't make you be seen any more quickly if you show up 2 to 3 hours ahead of time. So in addition, next Monday, we will launch a vaccination hotline that will assist those who have technology barriers to schedule appointments over the phone. So these are two things that we're doing, most especially to assist our seniors, is to have the accommodation for them to please wait in the car. And we will have that hotline ready for you beginning on Monday, because many, if they are anything like my mother, who still works a flip phone better than anybody I can remember, but does not do great with technology. So hang on, the hotline is coming and will be ready for you on Monday. We've also been working for weeks to get our teachers and administrators vaccinated as quickly as possible by forming a partnership to exclusively provide the vaccine to them. We have a plan in place to get everyone vaccinated that is scheduled to begin this Saturday. We'll begin putting needles in the arms of teachers and administrators on Saturday, and we want to ensure our teachers are protected from COVID-19 as we begin to consider when to bring students back into classrooms safely at a later date. But we'll begin first by protecting those who are charged with teaching them. And so I want to remind all of you that our vaccination push will be a long process. The reality of the situation is this. We have 95,000 people in Phase 1B alone. We want to make sure that all of our residents understand that it will take us several weeks or longer for individuals in 1C to receive appointments for vaccination. Still, we ask you please to go ahead and pre-register now so that we can vaccinate you when your time comes, and to make an appointment and to possibly schedule you if we have last-minute cancellations. So it still is important for you to go ahead and pre-register now. In the event that we do have some slots that become available, we'll have you in our system and ready to go. People who fill out pre-registration forms will be sent private direct links from the health department when it is time for them to make an appointment. And for those residents who are concerned about receiving a second dose, the health department will send you a link to schedule an appointment when it's time to come back and receive your second shot. And this is very important because I know there are some who have been concerned about whether or not they're going to be able to receive that second shot. I want you to know that Dr. Carter and the team have done an excellent job of making sure that we have set aside enough of the vaccine so that we are able to administer that second shot. We will hear, and to that point, Dr. Carter, I know will probably address that. If you have received your first shot here in Prince George's County, even if you are not a county resident, we will be administering the second shot to everyone who received a first shot here. We will hear more from our Chief Health Officer, Dr. Carter, in just a moment. But before I go, I also want to briefly touch on our county-wide COVID-19 positivity rate. We are thankfully seeing now a trend in the right direction, and he will give you more information about that. For the week ending on January 19th, our percent of positive COVID-19 tests dropped to 9.2%. And, you know, this is still not ideal, but we are really happy that we've seen it coming back below 10% is what we wanted to see. And so as a result, we are cautiously moving to indoor dining, which will resume on Friday, January 29th at 25% capacity. And this is unless, of course, there's some dramatic and unexpected change, but we are really confident that it is heading in the right direction. We are seeing incrementally over the last couple of weeks that it is moving in the right direction, and so we are comfortable that we can resume at 25%. To be clear, and I don't know how I can be any more clear about this, this virus is still very much a part of our community. But I believe that we're at this point going to be able to do two things at once. We're going to be working to vaccinate as many of our Prince Georgians as we can while maintaining testing and contact tracing. And it will be up to this community to help us slow the spread. So we're going to have to walk and chew gum, folks. We're going to have to stop the spread, vaccinate, and do everything we can to keep Prince Georgians safe at the same time. So I want to caution our residents and restaurant owners to do everything you can so that we prevent the spread of COVID-19. Please continue to do all of the things that we have said to you. Practice social distancing. Make sure that you are still not doing those family gatherings in your home with people who do not live in your residence. Wash your hands. Do all the things that we've been asking you to do to sanitize. Use all the sanitation guidelines that we've been giving you just so that we can stop the spread of COVID while we begin this vaccination process at the same time and get back to some normalcy. So now I would like to welcome Dr. Carter to the podium to give his comments, and then we will answer questions. Thank you.
Good morning, Madam County Exec. Good morning, everyone. As our vaccination rollout builds steam, we can't forget that the virus has a lot of steam left. COVID-19 is still spreading in our communities. The county continues to see very high COVID case numbers. January has seen cases hover over 3,000 each week. In fact, just a few weeks ago, we hit our highest case total of 3,748. Our daily case rate has stayed in the critical level for 2.5 months. The county adds, on average, 41 new cases per 100,000 population every day. Right now, our positivity rate is below 10%. Just 2 weeks ago, the positivity rate was as high as 11.7%, which is higher than we've had in the last 6 months. So it has started to come down. The latest 7-day average shows positivity is about 9.2, as the county exec said, and we are hopeful this number continues to stabilize. The positivity rate between 5% and 10% is still considered high risk, but it's coming down. Hopefully, we can keep it down. Our infection rate is back below 1. The infection rate measures, on average, and I say this every time, how many other people are infected by a COVID-positive person. Our infection rate is now 0.93. In other words, someone with COVID is passing it on to fewer than one person. We want to be below 0.9 to bring us into the low-risk category. We're still far from our lowest infection rate of the pandemic, which was 0.74. The number of people hospitalized with COVID-19 in the county is now back below 200. After dropping to 199 on January 17th, there are now 211 patients hospitalized with COVID-19. For the county's overall hospital capacity, which is 47% of the beds, that's very, very good. We've been maintaining and stabilizing at 47% of our ICU beds and our med-surg beds. So what that means is our hospitals are doing very well right now, and they continue to do well, and we thank them for providing our residents with that type of capacity. The latest key metrics prove that COVID-19 continues to spread and make a lot of people very sick, and that's for sure. But as the county exec stated, we will resume indoor dining because our numbers have dropped, and we're hoping to keep them stable. And we're asking your help to ensure these metrics keep trending down. So, as the county exec said, wear your mask over your nose and mouth every time you're in public. Stay 6 feet from each other. That's very important. Limit your gatherings to only the people who live with you, and keep your hands and surfaces as clean as possible. And get the shot when it's your turn. We're working to give more first doses to people in phase 1A and B who live or work in Prince George's County as soon as possible. And that means continuing to vaccinate frontline workers, first responders, as well as those in conjugate living facilities, group homes, and homeless shelters. More of our child care workers, teachers, and school staff are getting vaccinated. A partnership between Kaiser is getting finalized to help us vaccinate public school teachers and staff. But the group they really, really want to target in Prince George's County is our senior citizens, because they're the most vulnerable. If you're 75 or older and you're a Prince Georgian, we want you to get vaccinated now. Your age alone means you're at a high risk of getting really sick from the virus. To continue prioritizing Prince George's County seniors and those at higher risk in our county, we have to cancel first dose appointments for those who do not live or work in the county. We encourage these individuals to seek appointments in their county. Every jurisdiction is focused on the same goal, however: vaccinate our most vulnerable residents and workers as soon as possible. If you've received our first dose, you will be able to receive your second dose from us too. At the time of the appointments, all patients must present proof of county residency, or if needed, please provide employment identification to prove you work in the county. If you are a county resident or your work is here and believe your appointment has been canceled in error, please complete and submit the pre-registration form on our vaccine page to be rescheduled as soon as possible. For people in Phase 1C who live or work in the county and do not have an appointment before February 9th, you must fill out and submit a pre-registration form on our website, which is mypgc.us/COVID-19, COVID vaccine. Let me repeat it, mypgc.us/COVID vaccine. The way we can notify you when it's your turn to schedule an appointment will be either by phone or by mail as they become available. Among those eligible for Phase 1C vaccinations are people who are 65 and older, essential workers who are at high risk for exposure, like grocery store workers, postal workers, or those who work in public transit, public health and public safety workers who are not covered in 1A and 1B. Our vaccination efforts have escalated rapidly. We expect Phase 1C appointments to open up in the next few weeks or so. But we're continuing in 1A and 1B. We are now administering more than 1,000 shots a day at our 2 clinics. We anticipate opening a 3rd clinic this week, which we have, and our community partners with our hospitals continue to expand to help us soon vaccinate more people and move through our highest priority group safely and equitably. And that's going to include pharmacies and our providers who are out in the community. At last check, the health department has provided more than 6,500 doses to people, and as we enter this full week, we anticipate vaccinating at least 1,000 people a day. About a quarter of the total vaccinations we have provided have been to first responders, public safety workers, and healthcare workers who live outside of the county. That's not surprising since we are in Phase 1A, which is largely based on where you work rather than where you live. Despite this, 53% of all vaccinations provided by the health department has been given to Prince George's County residents. Of those who are 75 years old and up and have received a vaccination, 2/3 reside in Prince George's County. We anticipate this to increase quickly as more people in 1B get their shots this week. As of yesterday, nearly 21,000 Prince Georgians have received at least their first vaccination dose. About 44% of county residents have received vaccinations in other jurisdictions in the region due to their employment there. However, more than half of the county residents who have been vaccinated so far got them in Prince George's County. We are making great progress in this historic vaccination effort, but we know getting as many as 2 shots into people's arms of hundreds and thousands of folks is an enormous task. The county is vaccinating people when it is their turn, and we're doing it safely, equitably, and effectively, and efficiently as we can. We're on a journey. This is a journey to normalcy. And we have to look at forward. We have to look at making sure that our folks are vaccinated in that equitable way. Our team is doing this. We're going to accomplish this. And we hope that you all are patient with us getting to that. Thank you very much.
Okay, and with that, we'll take any questions from media.
Well, I'll answer the disappointment part of it. Yeah, I think it's totally understandable. I mean, everybody's eager to be vaccinated. I think Dr. Carter can speak to why the initial appointments were allowed to be made in the first place, but the point is that we realized that there was a need to correct it. What we want is to make sure that Prince Georgians, our seniors, and those who work here who are frontline and essential workers have the opportunity to be vaccinated in their homes. And because the supply is so short, we are now really concerned about equity. So I think, Dr. Carter, if you can just talk about the site and how it was that other residents were allowed to register here in the first place.
Thank you. Let me just start by level setting a little bit so you can know the context of this. And I'll state this by saying that if there was a national distribution plan, then we wouldn't be having this conversation. Because, and let me just set the tone so you'll understand. If we had a national distribution plan, this is what would happen. You would be able to go into a site, well, no matter where you live, and you would get vaccinated, just like what we did with testing. A national vaccination plan would mean that if you got a vaccine here and you decided to go to Florida and 2 weeks later, after 28 days you needed the second shot, you would get it because there would be a system that recognized that you had the vaccine and you would be getting it, and it would be a national rollout plan. All of the states would be on top of that plan. The local jurisdictions would. There would be no competitions. You wouldn't see charts of people of whether or not Prince George's County was here and Montgomery County was there. That wouldn't happen. What you would be as a resident, you would be very confident that you could go to the CVS and get your shot, well, no matter where you were. And so when this first rolled out, and because it rolled out earlier than we expected, we did ask, for how are we going to do this among jurisdictions? And I think the last time I was up here, I said we were going to cooperate with that. But what it turned out was and at the state also was consistent with that. And they said that you really can't constrict folks from coming from one border to the next. You should go ahead and do. However, that changed when we found out that we had to limit it. We had more control over it, and saying that the local jurisdictions have control. And then so we had to change very rapidly. All of that was because of my decision. I said, okay, because I started out by saying we were going to accept folks from other jurisdictions. And then I had to rapidly change that. So what we're doing now is putting in that correction. And I'm apologizing right now to all of the Prince George's County residents, because with the way we're doing it now is because local jurisdictions have to make those decisions, we have to then limit it to our Prince George's County residents. And we thought that it was going to be a situation where we were able to exchange from DC to Montgomery County, et cetera, but because of the way it has been stated, we have to do it this way. So we're putting in that correction. We're going to make sure our Prince George's County residents get vaccinated. And if there is any people who come across, we'll make sure that we help out each other. But we really do have to concentrate on our Prince George's County residents. How many people? I think I gave you the percentages. Let me be sure. How many people? Let me be sure.
I think we'll have to get that from the, yeah.
Yeah, because that is difficult to say, because we have people who work here, so it's that's. Let me get you that number.
Yeah, but like how many have you all had to cancel, and how many of those were vaccinated here that you would have liked to cancel before?
We'll get you that.
I'll have to get you that number, Tracy. I will. I'll get you that number. Okay, because I don't want to say off the top of my head if I don't know.
Just one question up front. The third site, is that going to be a state-run site, or is that county?
County.
That is county.
Mm-hmm.
And then the second one, is that the Southern Regional Technology Center down in Fort Washington?
Yes.
That's already open?
Yeah, today. It's open today. We're training people at that site today. And then when it opens, we'll give you a notice that when it's open, to appointments. I mean, well, actually, appointments are being started to put there now. But right now, it is open. It's set up and it's ready to go, but we're training our staff there today.
And still not sure about where the third site will be right now?
No, we're looking in Northern County. We have identified a site, but I don't want to say exactly until we get it all nailed down. But there will be a site will be opened up there.
So to be clear, how this thing happened, this issue that you're now correcting, was because of both the state website and your acquiescence?
It was, well, yes, it was because of yes, absolutely. We were trying to make sure that we aligned with what we thought where the state was going, and unfortunately we found out that we need to basically concentrate on our residents.
So Dr. Diddley Chan has said publicly there is no requirement that you get vaccinated in your own county.
Yeah, I know she has said that, yes. And I work very closely with her.
Email to see if they've changed that, but has that changed?
It changed. It changed because of the fact that it's difficult to, as you all have found out, to be able to vaccinate those folks in your jurisdiction with the limited supply that you have. Now, you should know, and Dr. Chan is right, if we had an unlimited, we had a adequate supply, and we had a national distribution plan, what she's saying is absolutely correct. But we have neither. So we have to do it this way to ensure that our Prince George's County residents get vaccinated.
So as appointments get canceled, you're going to grab people off the pre-registration list and say, hey, you got an appointment quicker than you thought?
That's correct. And then they have to be in 1A and 1B. And then later, as we get our 75-year-olds vaccinated and the people in 1A and 1B vaccinated, then we're going to start taking people off the list who pre-registered for 1C.
And Dr. Carter, that process started Monday.
Yeah, that process started Monday, yes. Does that make sense, Brad?
I was busy making notes and tweeting. So you're not going to 1C today?
We're people in 1C, we want people who go in 1C to pre-register. That helps us get them into the system when it's time for them to come on. Okay? Sorry, thank you.
All right, if there are no further questions, thank you all so much for coming.